Hello, in this video we will discuss about the lower back pain. So before the understanding the lower back pain, we will get the introduction and we will understand how the lower back pain will arise. So this is a lumbar pain, the lumbar region of the vertebral column, and due to some reason. So let's begin to understand. First is the here is the central nervous system, which that contain brain and spinal cord, while the peripheral nervous system means the arising of the neuron from the nervous central nervous system, like spinal cord. So this is the direction, and this is the vertebra, and the basically the herniated disc, which that will lead to pinched nerve to cause the inflammation and feeling the pain. So other reasons which that will lead to include the pain, and that pain will arise in the lower back pain or other back pain, but the mostly lower back pain. So the causes of low back pain we will discuss in this video. So this is a structural. Here the six vertebrae involved for the pain, while the neoplasmic pain is due to the two vertebrae lower the structural, and the referred pain to spine from which that is the three vertebra is involving, while here is the infection involving the further three vertebrae, which that will lead to due to the infection, and the inflammatory is the two lower than the infection site and three vertebrae, and the metabolic also involved. But in this video we will discuss about the infection will lead to cause disc discitis, osteomyelitis, and the paraspinal abscesses. And on the other hand, the inflammatory, which that will lead to cause the spondyloarthropathies and the sacroiliitis, while on the other hand, the metabolic involving the osteoporotic vertebral collapse, and the Paget's disease and osteomalacia and hyperthyroidism. So this is the bigger picture I am understanding. Again, this is the pedicel, and this is the transverse process, and this is the disc is present, and this is the vertebral body, and this is the disc is blue color showing in the diagram. So this is the disc, and this is the upper cross section area of the vertebral column, which that is called spinal cord is here and contain a butterfly like structure is the gray matter, while the outer is the white matter, the gray matter inside, and this is the nerve root arise from this, and this is the lamina, and the spinous processes, and the superior articular facet is here. This is suffering back pain. The back pain, basically the suffering back pain due to the some reason. Let's begin to understand. Number one, this is a normal disc. So the back pain will not occur, but in this way here is the bulging disc will lead to back pain, herniated disc, degenerative disc. It means the degeneration due to some process, the bacterial infection, and thinning disc. So the most common cause of low back pain is, let's begin to understand the causes of the lower back pain. So the strain and the sprains involve herniated discs as shown in the diagram, and the disc degeneration, spondylolisthesis, and the osteoporosis. Infection of spine and the sarcoleal joint pain, and cancer of spine also involve bladder infection, kidney stone infection, and the pelvic inflammatory disease, and the sleeping disorders also occur, which that will lead to cause the lower back pain, and the improper bending and standing or sitting. And beside this all causes, other causes is also involving for cause the lower back pain. For example, fever or night sweats, the bacterial infection, tuberculosis, the TB, and arthritis like rheumatoid arthritis or other arthritis. And in this way, the autoimmune disorder also occur, which that will lead to cause the low back pain. But anyhow, this let's begin to understand the pathway of the pain, how the pain will work. This is the damaged disc which that contain a sensory nerve, first order neuron, which that transmits the signal through a dorsal horn of the spinal cord, toward the dorsal horn of the gray matter from the sensory neuron, and in this way the dorsal root of ganglion involved will lead to sense and the interneuron which that is going to the spinothalamic tract. This is the spinothalamic tract, and this is the spinoreticular tract. But the spinothalamic tract is also involving for the lower back pain sensation, and also the spinoreticular tract. In this way, this is the neurotransmitters. The substance P is involving to trigger the neuron to the brain through a second order neuron. The second order neuron, which that will transmit the signal through a spinothalamic tract. And in this way, here let's begin to understand the spinal cord, which that's contain a three layer is known as the meninges. This meninges contain an innermost layer is a pia mater, while the middle is the arachnoid matter, and the outermost is the dura mater. It is also involved due to the basically cerebrospinal fluid infection, which that will lead to also cause the pain. So here is the white matter and gray matter, and the central canal is also present. Will lead to sensation in the brain with a specific region to cause pain, and that is why the pain we can feel, and this pain can be fixed through treatment. Let's begin to understand the treatment. For example, the first is we will just understand with the generally bed rest, antidepressant drug, anti-inflammatory drug if the rheumatoid arthritis, and the painkiller drug, opioids and morphine, which that is also drug which that cause the stimulant to decrease the pain, and vitamin D supplement which that will cure the bones, and the normal exercise for lower back. So anyhow, I hope you make sense about the lower back pain. This is the video about the lower back pain. Lower back pain is due to the many reason which that we have discussed in this video. I hope you make sense, and that is why the lower back pain can be fixed through our several drugs, and basically the pain can feel through our sensory neurons, and that is why this is a video about the lower back pain, and I hope you make sense about that things. This is the general overview. Thanks for watching. Bye.